We are at a critical leadership moment in the Alzheimer's effort. The administration has, in its framework for a national plan on Alzheimer's, proposed a national goal to prevent or effectively treat Alzheimer's by 2025. Now, I hope it's earlier than that, but a national time-based goal is something we've been advocating for. The administration now is putting it on the plate, and now the question is, how do we get there?
I think America and the world calls for the need for innovation in making sure that we have new drugs, new biomedical products, new medical devices to speed to the clinical practice of our people. And just in the same way we need innovation in the production of new drugs and bioproducts and devices, we also need innovation in the legislative process. A new way of moving legislation forward in a public-private partnership where it's not government owns and operates research and the private sector owns and operates the production of products. We need partnership, and we need it now.
I know that there is no more helpless feeling than gazing into the eyes of a loved one and receiving only a confused look in return. Alzheimer's alone costs the United States $183 billion a year, a figure that is only going to explode exponentially as the baby boom generation ages and as we live longer and thus become more at risk for Alzheimer's. If nothing is done to slow or stop this disease, Alzheimer's will cost the United States $20 trillion over the next 40 years.
We have to find the way in which we are going to find the solution to this problem. Research is medicine's field of dreams, from which we harvest the findings that give hope to families that there is a cure, there is hope. The real terrorist people are afraid of is not al-Qaeda coming into their neighborhood. It is that there will be another phone call that comes into their living room telling them that there is another disease which has come into their family.
There are models of success for this kind of approach. DARPA in the defense area has adopted exactly this kind of model, leveraging private resources and also private brains to make sure that we have the best and the brightest working on these problems.
We have to have a cure. We have to infuse the funding that will make it possible for us. The children will have to look to the history books to find that there ever was such a disease as Alzheimer's.